So just a few minutes about the Mind and Skin project. So we wanted, following Roxana's really practical advice about how to deal with the emotional well-being side of eczema, tell you a little bit about a research project that I lead that is not alone. There's a large group of people, which I'll mention in a moment, just to give you an insight into what we're doing to try to understand this link between our minds and our skin. I hope you can see this video that was very kindly shared by me by a patient's family. The parents were very distressed seeing their son's severe itching during his sleep even. Scratching, of course, leads to poor sleep. It leads to tiredness, to lethargy, poor concentration at work or school. And we see a lot of psychological and psychiatric comorbidities, as Roxana said, in our pediatric severe eczema clinic, but generally across the board with eczema patients. And this figure is just trying to bring all of our thinking together. So you have on the left upper hand side here, what we think are the main factors that driving atopic eczema, the genetic susceptibility, so that some genes, and very often eczema runs in families. There is this defect of the skin barrier that leads to skin dryness to begin with, and then skin inflammation, and then environmental factors such as environmental pollution, hard water, if you live in London and surrounding counties, for instance, driving the inflammation that leads to chronic itching, scratching, further disrupted skin barrier, the sleep disturbance we were talking about. We're seeing quite a bit of attention deficit hyperactivity disorder, as well as anxiety, depression, social withdrawal in our patients. We think there is a direct link here, which still needs to be further investigated, not just as part of our project, but we also think that the cutaneous inflammation that's leading to the itching and the severely disrupted sleep impacts our brains, how our brains function, and potentially leads to inflammation in the brain as well. Of course, the brain through the spinal cord links straight to the sensory nerves of the skin. And we know that patients with eczema, like branches of a tree, grow and grow further as the eczema is increasingly chronic. And our patients very often describe that itch actually then evolves into pain. People are becoming hypersensitive. So there's this link from the skin directly to the brain. We think maybe also a spilling over of all the chemical markers that are upregulated in eczema going into the systemic bloodstream, and then through that across the blood-brain barrier into the brain itself. So as another feedback loop there. And we want to investigate how that actually happens. Now, there are 3 groups in this study, each 30 participants large. We are recruiting adolescents, so patients aged 12 to 18. In group 1 with severe eczema, those starting systemic treatment, so methotrexate. Group 2 are patients with eczema who are just on topical treatment, so the usual emollients and anti-inflammatory creams. And then group 3 are healthy adolescents. And so all 3 groups have a detailed sleep studies. We're testing their cognitive function. We're doing structural and functional MRI testing. We, of course, look at the eczema severity, and we also have some non-invasive ways of looking at the chemicals in the skin. We're also, for instance, looking at the skin microbiome, so the bacterial flora on the skin surface. For group 1, that's the one that's particularly severe, the patients who are starting methotrexate. We want to know what happens to the readouts of the sleep measurement, the cognitive testing, and the brain imaging as hopefully the eczema improves. Here are some of the devices that we are using. So we're using what's called polysomnography. That is the currently state-of-the-art way of measuring sleep. That includes measuring the electrical activity of the brain, for instance, the heart rate, the respiratory rate. We're also using a very novel device called the Dream headband that can almost do exactly what is available with the measurements that usually require a lot of electrodes being attached to the scalp. You can see it there on the right-hand side. We're using actigraphy watches, which detect scratch behavior during the night. And then we also have a mattress device that measures movements during people's sleep. And that's just a picture of a patient going through an MRI scanner where we are asking them to perform standardized tasks to test motor response, attention, and time perception. This is the group of people that we brought together. So we've got pediatric sleep medicine experts in addition to our dermatology team. We have pediatric brain imaging experts from our Institute of Psychiatry, Psychology and Neuroscience at King's College Hospital, the Maudsley at Denmark Hill. We've got a psychologist as part of the team. We've got pediatric brain imaging experts, an itch expert from the University of Copenhagen, and a colleague who knows a lot about the body clock and what happens when it is disrupted from Surrey University as well. So it's a really exciting group of people. This lady here is Shona Cameron. She's the research fellow working directly with me and driving the recruitment process of the study. If you'd like to know more about the Mind and Skin study and maybe even want your child to take part in the study, please get directly in touch with Shona. Her email address is there. As part of the Mind and Skin program, she is currently running a patient as an adult parent, as well as patient surveys. You've got the QR codes here. If you want to scan them in and be part of that survey, that would be great. And otherwise, if you'd like to follow our department's research activities, in particular, want to be updated about progress in the Mind and Skin project, then please follow us on Instagram, the Facebook page, or on Twitter. That's all from me. And it's now a great pleasure to introduce Andy Proctor. Andy is the Chief Executive Officer of the National Eczema Society. And Andy, since you took over, I don't know how many years ago, the NES has come a very long way. I mean, you provide excellent information and advice for people with eczema and their families. You raise awareness of the condition, but you also support research. And we're particularly grateful for that, both at the national level, but also international level, representing the patient voice in research studies. That's really very much appreciated. Andy, you ran a survey that you'd like to tell us about. Over to you.
Thank you, Carsten. Yes, find that survey. Give me 1 second. So yes, I want to talk to you today about the survey that we conducted as National Eczema Society. It's about, we asked the patient community, our eczema community, about how eczema affects people's mental health and emotional well-being. And we've been talking about this during National Eczema Week. So I just want to kick off with what we did. So it was an online survey we conducted in April and May this year, and it was promoted to our networks of communities. There were 16 questions on the form and a free text response option at the end. We had 586 responses, mostly identified as female, good representing of age, and almost all had a diagnosis of eczema and had eczema since they were a child. It's difficult to see everything on this slide because we asked quite a few questions, but we asked questions around, does eczema make you feel depressed or sad or anxious, unconfident, embarrassed? And as you can see from the large graph responses on there, these were coming in at mostly 70, 80, sometimes higher responses. That's the people saying that eczema did do that. The only one that's very small there says, does eczema make you feel more confident? And not many responses to that one. In the free text field, we asked people to say what, to try and encapsulate how it made them feel. And there was lots of really powerful, emotive language trying to encapsulate what it means to people, and this changes over time depending on how the eczema is at any point in time. But one of the questions we asked, and Ruxana talked about it earlier, was, does eczema ever make you feel suicidal? Do you have suicidal thoughts? And 28% of the respondents said that eczema did give them suicidal feelings. So this is a really significant thing that often goes underreported and under-acknowledged. Another big graph here, looking at different questions. Again, you won't be able to read it very well, but we asked questions about, the top one is about difficulty sleeping. Does eczema make you feel self-conscious, worried about the future, impacting on your relationships, how it affects work and study? And again, most of these responses come in around 60% of respondents and go up to 80% or higher. So it affects so many different aspects of your life. This question was particularly telling. It's sometimes hard to open up about eczema, even to people who you know very well. And this question, do you feel others really understand how eczema impacts on you? And 70% responded no. Have you ever talked about how eczema makes you feel with a healthcare professional? 50% of people said no. If it's not even on the table in a consultation, how on earth are people going to find the support that they need to manage the emotional and psychological impact of this very complex condition? In the free text field, I think I mentioned too, we asked people if they had any further thoughts. We had lots of responses, over 300 responses in the free text field. It's very unusual. Normally people have felt they've had enough after answering 16 questions, but these were all so heartrending and difficult to read in different ways. And some of the responses here that I've just pulled out, but we had just under 300 responses. And the one on the top left there, it says it's a life sentence of self-loathing. I mean, this just gives you the visceral feeling of just how hard it can be. It does feel rather sad in the sense that National Eczema Society led a very large survey and report back in 2020, which we called Eczema Unmasked, and we asked similar questions about how eczema make you feel, how it impacts on your physical health and your emotional health, your life chances, and so on. And so not a whole lot have changed since 2020. So we feel there's still so much to do to raise awareness, raise understanding, and make sure people get the care that they need to manage their eczema appropriately. Thank you very much for listening.